Good morning, Chair Ballendraff, members, homes, staff, and guests. The lobbies are open. The recording has begun.
Thank you, Gretchen. Good morning and welcome to the Board Caucus meeting of the Liquor and Cannabis Board for Tuesday, March 18th. Board member Garrett is away today, and so we've got Board member Holmes and myself. We have a very full agenda, and I'm looking forward to having these great discussions this morning. But we'll start with our first agenda item, Mark Webster giving us a legislative update. So Mark, I'll turn it over to you.
Good morning, Chair Ballendraff and Member Holmes. This should be brief because we're in an odd time in session. Last week, the first half was spent in long floor sessions leading up to Wednesday's House of Origin cutoff. That sent several bills into the opposite house, and now they're scheduling those in the policy committees where they've landed. But maybe due to timing and volume, most of the bills that we're following haven't yet been scheduled. None of the bills we're tracking was heard yesterday or today, so we're just kind of in a holding pattern, if you will. But that's going to start to change. Senate Bill 5758, which reduces the buffer zones for new social equity and cannabis applicants, that, how close to a school or a park and things like that they can be. That bill has a hearing in House Consumer Protection and Business tomorrow. So that bill kind of represents the Senate's effort to solve some of the problems that they're hearing from social equity applicants and those folks who face challenges in securing a location and opening a retail store. As you know, the House's idea, House Bill 1551, passed as well. While it hasn't been scheduled yet, it could be as soon as next week. So as you'll recall, that bill originally included a pause on social equity licensing, but as it's moved through the process, some of those policies that were a bit concerning have fallen off. What remains is essentially a study bill asking the LCB to quickly figure out what the successful applicants did and what barriers still remain for those who are still looking. But it also makes the change to allow Commerce's grant funding that comes from the dedicated cannabis account to flow to new recipients. Now, we have some concern about our ability to do a meaningful and rigorous study by December of this year with no new resources, but it is important to know that the bill does not pause either round of social equity licensure. And also yet to be scheduled are several of the alcohol bills that have been passed by the House. Those include most notably House Bill 1515, the World Cup Fan Zone and Outdoor Alcohol Service Bill. I don't doubt that it'll get a hearing, but it hasn't been scheduled as of this morning. Also in this category are House Bill 1602, the Contract Kitchens Bill for wineries and breweries and the like, and the Purchase Limit Bill 1636 to allow for retail sales selling to on-premise licensees like restaurants. The one Senate bill on this topic will go to Finance, not Labor and Commerce, and that's 5368, which is a comprehensive study on alcohol taxation and fees. On the cannabis side, we have three moving from the Senate to the House. Those are 5403, which is on management agreements and trying to limit folks from having control of more than 5 retail outlets. And then 5758, the buffer zone bill, which we've already discussed. And then finally 5206, which was the cannabis retail advertising bill that we've seen the last 3 years. There is one House bill on the subject, which is House Bill 1347, dealing with lab accreditation and certification. But just because we're through the cutoff doesn't mean new bill introductions have completely stopped. Bills that impact revenue can be considered necessary to implement the budget and aren't subject to those cutoffs. So we've talked a lot about the out-of-state ownership bill, which had been House Bill 1940, but a newer version of it mixed with other policies like the management agreement language has now dropped as House Bill 2037. And House Bill 2035 would raise the fees charged for most of our liquor licenses and permits. And then finally, House Bill 2033 targets the loophole by which synthetically derived nicotine products escape taxation because they're not tobacco products. So they're neither cigarettes or other tobacco products. And that bill has a hearing on Thursday in House Finance. So I will leave it there and see if you have any questions.
Thank you, Mark. I just have one question about the synthetic tobacco. Do we know anything about the size of that market at all?
I don't. I don't know if some folks from finance or whatnot can get back to you, but certainly there are some products that have kind of blown up or are growing in market share.
Okay, I'll follow up and ask. Thank you. Member Holmes, any questions of Mark?
No questions. Thank you.
All right. Thank you, Mark. Appreciate it. Okay, moving right along, we're going to have our update on social equity. So we've got Aaron, Linda, and Sarah.
Good morning. So good morning, Chair Bollendrath and Board Member Holmes. My name is Linda Thompson. So for those of you who I haven't met yet, I'm the Cannabis Manager and Licensing. I'm joined here today with Erin Washington, the Cannabis Social Equity Program Manager, and Sarah Worley, the Social Equity and Cannabis Case Manager. I always get those switched up. So the next slide, please, Gretchen. Raise the first slide. Yeah. So let's go to the next slide. All right. So I think backed up one more. We'll go here though. All right. So this next slide is our presentation overview. So if you back up one more, should be a. One more. Oh, there it is. Okay, perfect. Thank you. So today I'll be providing an update on the statuses of the current social equity applications going through the licensing process, barriers applicants are still facing, and sharing the counties in which a social equity license has been issued. Then you'll hear from Sarah, who will be sharing our outreach and education efforts with local authorities and applicant videos, and then Erin, who will be providing an update on Alto Point Consulting, our third-party contractor, along with next steps. So the next slide, please. So our social equity program developments in the next slide. All right, so this slide represents all of our pending social equity applications. The graph on the left represents the 40 social equity applicants. As you can see on this chart, 32 applicants are still going through the licensing process, while one license was withdrawn per their request. Those 32 applicants have not secured a location, therefore haven't moved forward in our next steps of the licensing process. And just as a side note, there was no time limit to find a location nor secure funding. So the chart on the right represents title certificate holders who applied and qualified as social equity applicants. So a title certificate holder is a licensee who was unable to open for a business in the city or county where the cannabis retail license was originally located due to a ban or moratorium. Those who applied under the social equity program allow the title certificate holder to reinstate their existing license and locate anywhere in the county where the cannabis retail license was originally located. So they did not have to be scored when they applied to the social equity program, but they only needed to qualify as a social equity applicant. So as you can see in this chart, there are 3 applicants still looking for a location. They're located in King, Pierce, and Lewis County. So the next slide, please. All right, so on this map, on this slide is a map of all the counties in which a social equity license was issued. So there's been a total of 9 social equity licenses. They've been issued in Berry, Snohomish, King, Pierce, Franklin, Grant, Benton, and 2 in Clark County. 2 of the 9 were issued to retail title certificate holders, and those were in Clark and Benton counties. The next slide, please. So barriers to licensure. So the social equity team and senior licensing specialists have been in continuous contact with social equity applicants. Through these conversations, applicants have shared barriers they're running into, which appear to be consistent throughout. The most common barrier social equity applicants have reported to us is finding and securing a location. So applicants are facing challenges in finding a compliant location due to distance requirements from restricted entities or added zoning requirements within their jurisdiction, plus jurisdiction's additional restrictions, for example, proximity to another retailer. If a compliant location is found, often the costs associated with making the property usable, including construction expenses, are high. It's an undesirable location for a retail store, so it's an area that would potentially not get as much business. Or landlords are not willing to lease to a cannabis business, and if they will, the rent is inflated due to it being a cannabis business. The limited compliant locations most likely doesn't help with ensuring reasonable rents. Now I will pass this on to Sarah to provide an update on our outreach and education efforts.
Thank you, Linda.
You're welcome.
Morning, Sarah.
Good morning. Good morning, Chair Valandroff and Member Holmes. As Linda said, I am Sarah Worley. I am the Social Equity Case Manager. And today I'm going to speak about the local authority outreach efforts the social equity team has been doing for the last about 3 to 4 months and our education videos. You can go to the next slide. And one more. Thank you. I wanted to start off with the survey that we had sent out to our local authority at the end of last year. We had some great success and response with the survey that we had sent out to the pending 2870 applicants, which was some of that barrier information that Linda provided. So we thought we'd reach out with the LAs in this form because our past outreach, we just didn't get that response that we had wanted. So we had received 23 responses, which is more than we had received in the past. Our survey asked if they had cannabis in their area, if they had buffer zones, if they'd like some more information about buffer zones, if they knew that they could increase the amount of cannabis business in their jurisdiction to bring in more social equity licenses, if they understood there wasn't a cap, and if they wanted some more information about the social equity program in general. You can also see the list here was a lot of our respondents. Majority of those were the ones that did respond and answered most of the questions. The questions were not required, so a handful of them just, pick and choose what questions they answered. But our list there on the right was those answer majority of our questions.
Great.
We also did even ask if they were interested in joining a virtual or in-person presentation or being on a panel. And we only had 3 people that said they'd be interested in joining a discussion. So we've reached out to those ones in hopes that we can have that one-on-one since we didn't have a large amount asked to actually create some type of, panel to get together. Next slide, please. Then our next outreach, we emailed a letter out about excise tax distributions, how the jurisdictions can benefit with these excise taxes if they have cannabis retailers in their jurisdictions. We then followed up with this information addressing directly to our city managers and mayors and county commissioners, specifically on those who currently have a ban or moratorium. We've made some great connections with a handful of local authorities. We are just starting those conversations, building relationships. They're asking questions about social equity program, the buffer zones, allotments. And when we do speak with them, we make sure that we let them know that we're happy to join a council meeting, answer further questions if they have more questions or the council members themselves do. Which brings us to a couple meetings that we have had. Towards the end of January, we got to meet with the City of Pacific, 2 of their members, who have recently made changes to their ordinance and to allow cannabis. They asked some information about the social equity program, some history about where it started, about 502 and such. And then they did mention that that excise tax was actually an incentive for them to open and help them lean some of their board members and council members towards opening up that. So that was a great thing to know. Yeah. We have also recently spoke to the city of Tacoma. They just asked some clarifying questions. And we do have a presentation scheduled with the city of Linwood at the end of the month. It was supposed to be last week, but it got rescheduled. We've also recently reached out to the Washington City County Management Association. We haven't heard back yet, but we're hoping to be here back soon. We will continue our efforts to build those connections and relationships with our local authorities. Any questions before I move on?
No questions. Member Holmes, any questions?
No questions. Thank you.
Sir.
Next slide, please, Rick.
Actually, let me make a quick comment. It's not a question. And just, recognition of the effort that you all are going through to make those local connections and to help at the local level, cities and cities in particular understand the value and the opportunity here. So I really appreciate the effort and the work that you guys are doing in that particular area. So thank you.
Appreciate that. Okay. So we have some education videos. We're super excited about this. The social equity team has been working hard on creating some videos that we'll be sharing with the applicants about the program, and we'll assist them through applying for the next window. The videos speak to what the Cannabis Social Equity Program is, a little bit of history and legislation on it, how to qualify for the social equity program. So we cover the 4 qualifications, and then you must meet 2 of the 4. The third video will be for when the window does open, about the registration process, because last time they would have applied through business licensing services. This time they will actually be applying through the new leads system that'll be coming out. So it'll be directly with LCB. Video 4 reviews the types of documents that can be used to verify qualifications for the scoring. So it's our scoring rubrics documentation. And then we'll follow it up with a video 5 that will talk about the next steps for the applicants once they are moved forward, they've been selected to proceed as a social equity applicant. And that'll cover, registering with Secretary of State, how you would apply with BLS, making sure you have your registration number that you'd receive, and then how it would make its way to LCB and assigned to their licensing specialists. Questions?
No questions. Member Holmes, any questions? No questions.
All right, I will pass it off to Aaron.
Thank you very much, Sarah. Morning, Aaron.
Morning. Thank you, sir. I appreciate that. A good Tuesday, Chair Volendroff and Member Holmes. I'm Aaron Washington with the Social Equity Program Manager. I will be addressing the communication plan for the next registration window for the Social Equity Program under Senate Bill 58. Before I go into that, I will provide a brief overview of our third-party contractor. If you go to the next slide, please. Next slide, please. Excuse me, go back. I'm sorry. Oh, no, you're good. You're good. No, you're good. You're good. Just a little game, get you warmed up. All right. As of January 3rd, 2025, AltaPoint Consulting, LLC, which we will refer to as AltaPoint Consulting, was established as LCB's third-party contractor to determine eligibility for the next round of applicants under the Social Equity Program. AltaPoint Consulting is a Seattle-based organization with over 40 years of experience with a nationwide network of over 400 consultants, bringing a deep understanding of federal, state, and local government processes. To date, AltaPoint Consulting is on schedule to complete 3 of 6 deliverables after weekly meetings with the LCB since achieving the kickoff meeting on January 9th, 2025. AltaPoint consultants have presented configurations for the data management system known as the reviewer platform, which will be used to store and evaluate information that will be coming from future registrants. We go to the next slide, please. Staff from the licensing division's social equity team, the education and training team, as well as the cannabis unit have experienced an admirable test trial of the reviewer platform system and provided feedback about its functionality for next steps. And completion of the reviewer platform is anticipated to occur April of 2025. Next slide, please. The slide in your view contains the anticipated timeline as well as external communication for the next window to open. Please note the anticipated timeline shown is tentative and may be contingent on current proposed legislation about the social equity program, which is being heard during this legislative session for 2025, as Mark shared with us. External notification for the actual date of the registration window will be communicated through GovDelivery, LinkedIn, Blue Sky, and go to newsletters of organizations that are in support of the next round of applicants for the social equity program. The social equity team will be entering a blog at the end of this month, March of 2025, to encourage prospective registrants to watch the education videos that will assist with understanding the evaluation process before and during the registration window, as Sarah had mentioned. And a note to the public, the LCB has been in the process of a systems modernization project, also known as SMP. Recent accelerated progress has made the new licensing, enforcement, education, and administrative data systems, also known as LEADS, ready to launch March 31st of 2025. The social equity team believes the launch date for LEADS has been confused as the date of the registration window for the social equity program. LEADS is a key part of the new process for those most impacted by the war on drugs to register for the next round of social equity program. Registration will be a 30-day window and is only to identify who will be able to proceed with an evaluation by AltaPoint Consulting, which is anticipated between late spring, early summer 2025. After the closure of the registration window, registrants will receive further notification from AltaPoint Consulting about when to submit their documentation for the evaluation through the reviewer platform system, which is anticipated for summer 2025. Prospective registrants are encouraged to begin gathering documentation to support their circumstances that reflect qualifications and garners a score that best represents the extent of disproportionate impact from the war on drugs. Again, I emphasize the anticipated timeline you see is tentative and may be contingent on future action during this legislative session of 2025. Any questions from the board at all?
I have no questions right now, Member Holmes.
No questions. Thank you.
All right, Aaron, though, before you step down,
Sure.
I just wanted to make sure you were done before. I do have a question that's more for any of the three of you that presented. And so based on what you've said today, it sounds like things are going well and that we are on track from your perspective. Is that right?
Yeah, that's fair to say. Again, the legislative action might deter otherwise, but we've carried along as we had intended.
What are the challenges that maybe we haven't talked about right now? Is there anything that you can identify that are challenges? And I'm asking that question from the perspective of, is there something the board needs to be doing at this particular point that would be helpful to you? Or do you feel like you've got all the resources and tools necessary to move forward?
I think continued advocacy for social equity is very important for the board. I think the efforts for us to reach out to the local authority is definitely one that we would appreciate people's support with. Again, a regulated market is very necessary, and I think it's something that we can achieve provided we have people participating in that process. So I would ask that of the board to continue to spread that message.
Great. And I asked that question thinking about the outreach to local communities so if there's ever a need for a board member to participate in that, if it would be helpful to have that kind of support during those meetings, I wouldn't hesitate to reach out and ask that if you would find it helpful.
I'll hand it over to Linda.
I know, I'm just coming up here because in case there's any other questions.
Oh, okay.
That was it. I just wanted to check in and thank you for all of your work. From my perspective as well, based on what I've seen and what I've heard, it's going well, and I commend the work that you guys are doing. So thank you.
Thank you very much. Appreciate your time.
Okay, of course. All right, thank you. We'll move on to our next agenda item, which is our Liquor and Cannabis Board Research Program and an update on the Healthy Youth Survey update as well. So Sarah, come on up.
This mic over here.
Yeah, please do.
Okay.
Yeah.
When it's wireless too, great. Well, hello.
Good morning.
Member Holmes, wonderful to be here to present for the research program updates. And I'm here with Tyler and Nick to help present the program updates for the research team. And we also have a special guest with us, Kirsten Haley, our public health education liaison, to help us present on the Healthy Youth Survey updates as well. Because both of our teams, the research program and Kristen's team of one, both work on the Healthy Youth Survey. So the last time we gave updates, we were presenting on the dashboard, public-facing dashboard initiatives, but this presentation is more so a broader sweep of what the research program has been working on. So we're not going to go into anything too specific, but giving a highlight or overview of what we've been doing. We also don't have too many slides for the half hour that we've been allotted, but the reason why we did that is because if there is something that you two are interested in talking about or are having a discussion about something in particular, we've made time to allow for that discussion.
Great. Thank you.
You can move forward, Tyler. So the way that we've set up this brief overview is through the agency-wide strategic plan. So at the start of this fiscal year, the agency got together and created action items for each team and division for how each team can have tasks that contribute to the strategic plan of 2024 to 2029 under each goals. So for goal number 1, and you can move forward, Tyler. The agency-wide goal number 1 was that all Washington communities have the highest level of public health and public safety. And our research program had 2 identified tasks. And those 2 tasks were to publicly share 10 research briefs and to develop foundational public-facing dashboards. And we're excited to share that we're not done with these yet,
Making
but
good progress.
we have made really great progress on these. So we have, in fact, shared more than 10 research briefs, and we have started to develop foundational public-facing dashboards. So I'll let Tyler go into the research briefs that we've shared so far in this fiscal year, and then I'll let Nick go into brief updates on our dashboards. And again, if there's something in particular that you're interested in talking about, please let us know.
Okay, before we move on, can I ask a quick question?
Yeah.
So related to the research brief, so I have been impressed with the volume of research briefs that you guys have produced and the quality. And I had a question about, and you probably talked about this early on, but can you just remind, particularly thinking that we've got a new board member here who wasn't present when you originally talked about the research briefs, how do we come up with those topics? How do we decide what topics and how might a board member approach the research team if in fact they had a particular area of interest that they wanted to have the research team consider as a research brief?
Yeah. Tyler, do you wanna take a stab at that?
Sure. So I already advanced the slide, but number of factors go into considering and prioritizing research briefs. Again, they're meant to be non-technical summaries of issues that are sort of timely, relevant, and of interest to LCB. And we get requests from different members from LCB as well as partners. So pretty easy to kind of add to that list of briefs under consideration. You can email us and let us know. We can have a conversation about it and sort of give you a little bit more context of, what are we considering right now? When might that fit into our timeline? But yeah, number of things being considered, but we try to make it, again, kind of timely, relevant, and prioritized based on what LCB's working on or issues that are coming up.
That's great. Thank you.
And we can give you a few examples. So the other week when you two had, when the board had a discussion about home cannabis cultivation, we took that in stride, and we actually will soon be publishing a research brief on home cannabis cultivation. There was and Kristen and Tyler, correct me if there was is it the Prevention Summit last, a few months ago? And Kristen, you put up a really cute display where people put pebbles in a few research brief topics. And one of the briefs that we'll be working on relates to what the topic related was the most highly voted on. So that was something that was direct to the community.
Great.
Justin has also, if there is a rule project or something where Justin has come to us and said, you know what, there's been a lot of conversation about X, Y, or Z topic, and can you look into what is out there, what science is out there, what research is out there, just so we can see and get a well-rounded topic of well-rounded understanding of what information is there, so we can make a well-informed decision moving forward.
And so it's from multiple perspectives that you're drawing from, and
Yes.
the brief is created. That's great. And one of the things that, and Member Holmes, this is somewhat for your benefit, the value of having this research team and the proposed changes that I've been talking about on for the board are so that we can have more substantial conversations in caucus around various topics that demonstrate the board's leadership in these particular areas and the board's opportunity, particularly pre-legislative session, but at any time, frankly, to demonstrate where we sit on a particular topic, how we're informed about that particular topic, and to have these kind of open conversations in board caucus meetings that kind of set the tone for the strategic vision and plan of the board itself. So these topics are, again, just good examples of conversations that I'm hoping we as a board have more often in caucus as we look at potential and proposed changes that we've been talking about. So thank you. Appreciate it. Member Holmes, any questions?
Just a comment. I haven't been wanting for things to read in my onboarding process, but I particularly enjoyed these research briefs and in meeting with Sarah as well. I'm sure we'll come up with some great topics as well to add to this list. And I do look forward to talking about being proactive with some of our initiatives going forward.
Yeah, great. And I'll just make one additional comment, and that is it's unfortunate that board member Garrett is not here today, but I would like to create an opportunity for her. And, obviously she can watch the recording of today's, which I'm sure she will, but also create an environment where she can engage. And I'm sure you meet with her on an individual basis. So anything that we cover here that you feel is relevant, please cover that with her when you meet. Okay, thank you. All right, Tyler, sorry about the interruption there.
No, not
Oh.
it's interruption. We planned.
Okay,
we
perfect,
planned for
perfect.
That's why we're here. I'll also just point out additionally, as I think a lot of folks are aware, a couple of these comments, a couple of these topics were also bills in the current legislative session, such as a version of licensing for cannabis consumption sites, as well as home cannabis cultivation. So we've kind of covered the topics in sort of as we've talked through this, but we've sort of categorized them into these three topics you see: liquor, cannabis, and other. And then I thought I would detail just some of the challenges with summarizing these topics. So we have found there's limited research available on certain topics. We are aiming to summarize what is out there, right? What research is out there. People who have conducted studies, often from academic groups, but also others. And frankly, a lot of the topics we're talking about are emerging. They're new topics, and that's why we're interested in them, right? We want to know about them. We want to know before, for example, engaging in rulemaking. We want to know before moving forward with something. And oftentimes there's just not that much out there yet. And so you'll see we always include I think every single brief ends with a more research is needed section at the end for that reason. Sort of similarly, usability and or limited outreach. We're still figuring out how to best utilize these. I think we are increasing, visibility within LCB, doing presentations like right now, but trying to understand how can we best broadcast these using our different networks, our partners, things like this. We're also have a interest in understanding how many folks are visiting the website and downloading the briefs as well. And then finally, differences in legal versus science definitions. We find ourselves, again, our initial sort of process is to summarize the scientific literature, but a lot of these topics are often really end up being a summary of policy across different states, since we have such a, particularly with cannabis, such a diverse policy environment, not just in states, medical or non-medical use, but then all of the different topics within those by state. So, and another example is sort of even the legal versus scientific definition of cannabis versus hemp, for example. That's largely a legal definition and not a scientific one. It's the same plant. So those are some of the challenges we've encountered. If anything else there, otherwise I'll move forward.
I just have one comment about, and this is, again, thinking about the potential topics for briefs and an area that I'm really interested in. And it's looking at Washington State data. And I know that some of the briefs that you put together do include local data, but I'm also interested in looking, and perhaps we'll actually get there when we talk about the Healthy Use Survey today. But I'm also interested in briefs that take local snapshots of data and then provide analysis on that particular data so that we can use that, one, in policy decisions, we can use it in proposals, but we can also potentially use it inter-agency. So one agency may see some of the data that we're talking about in one of our policy briefs, and in fact say, hey, we've got data over here that if we pulled your data, our data together with your data, it might tell an interesting story. So just really thinking of opportunities to look at data. And I know you guys have done some work on tightening up, if you will, or cleaning up our data process. But I think that would be another area that I'd be really interested in terms of policy and research briefs in the future.
We love that. And that's one of the reasons why we started expanding our definition of research and data briefs. And we are going to touch a tiny bit on this, but we have been working really hard on collaborations and building out data collaborations so we can start building out we want to build out a brief library, but we also want to build out a data library so we can start expanding on our ability to tap into that local data as well, because we would love to do that.
Yeah. Well, and then national data. I'm thinking about Canada and thinking about, I'll give a simple example that I can think of, and that is compliance checks and comparing our compliance checks, whether it's alcohol, tobacco, or cannabis, with other states and see where we compare to other states in terms of our compliance rates. And, in cannabis, I know we do extremely well. Our retailers take that very seriously and do a great job. It'd be great to see how we compare. And perhaps we've got something to teach other states around what we're doing here in Washington State to actually achieve that compliance rate. Alcohol, I think we could probably use some work. And so perhaps in reaching out to other states and finding out what their compliance rates are, we know which states we might want to reach out to actually learn from. So I'm super excited about those kind of possibilities.
Well, and you teed us up very nicely to talk about future compliance rate data that we at some point soon will be able to showcase.
Great.
But just really quickly, if we are trying to figure out how to expand our outreach with these research briefs.
Yeah.
So if anyone has ideas, we're open to hear them. But
yeah, I was actually going to go back to that real quick, and usability and limited outreach. And that is an area that I'll give some specific thought to, and would appreciate other board members giving specific thought to how we might help or assist the research team in dissemination and figuring out ways in which we can use these briefs more broadly. Yeah.
Right. Over to Nick.
All right. Morning, Chair Bollendorf and Member Holmes. Thank you for teeing me up. Last time I was here presenting to the board, I presented our first two public-facing dashboards, which were on the dedicated cannabis account and international cannabis policy study, both of which are linked on our dashboard webpage. But there are two more dashboards that are nearly completed and are starting to enter their final approvals process, and both are on youth access compliance checks. And this is when an underage investigative aid attempts to purchase an age-restricted product while being observed by either an LCB officer or FDA inspector. So the first dashboard covers compliance checks for liquor, cannabis, tobacco, and vapor, that are conducted by LCB officers. And the second has information on youth access checks on tobacco products for checks conducted by FDA inspectors employed through LCB. I just wanted to give a quick thanks to Captain Rayfield and Mark Siegfried for helping to pull and clean the data for the LCB compliance check dashboard, as well as Susan Ekstrom for her expertise on the FDA dashboard. Also on the dashboard front, you can see in that picture on the right that we've started to expand the dashboard page to include links to other state and federal agency dashboards that are relevant to what we do here at LCB, particularly those like the dashboard for the Healthy Youth Survey and several dashboards created by Department of Health. Tyler, you can move to the next slide.
Hey, Nick, can I ask you a quick question before you go much further?
Definitely.
Do you have, and this actually applies to the viewing of the briefs too, do we have data on how many, are people actually accessing our dashboards yet? Or is that another area where we need to do more outreach and look at usability, or how are we doing it with that particular piece of the dashboard?
Quick answer, we've put in a request to be able to access data on that. So,
Okay.
So we're working on getting those numbers.
Okay, great. Because that would, I think, be really interesting. And again, give us opportunity to look for ways in which we can help with that usability and dissemination.
Mhm.
Go ahead, Nick.
Yep, absolutely. Great question. The last piece with dashboards I just wanted to touch on quickly was to highlight the approvals process that we've developed for creating these dashboards. Behind the scenes, we have a pretty comprehensive review process where each dashboard goes through multiple reviews, revisions, and approvals through multiple divisions and teams throughout the agency before being published. And we just really want to make sure that there's a lot of accuracy and quality in the information that's contained in these dashboards, which is why we think that this process is very valuable. But the full review process from pre-approval of a dashboard idea to actually publishing it on the website can take over 200 hours of staff time. So it is a rather lengthy process that we've put together. But of course, the last thing I wanted to throw out is that as we're building more dashboards, let us know if there are topics that you would really like to see a dashboard for, and we're happy to see what we can do with that.
Great. Member Holmes, have you been exposed to the dashboards in your conversations with the research team to date?
Briefly, yes.
Okay, great. Because I encourage you to spend some time on them and take the team up on suggestions for other dashboard information that you would find helpful in your role as a board member.
Thank you. I will. In the meantime, this is great fodder for a data and policy wonk like myself.
Next slide. So then just moving on quickly to the second strategic goal, agency-wide is being accessible and responsive to the needs of our communities and partners. The research program was tasked with building out an external agency-wide approach. Can you hit the next button? Of having a coordinated approach to external surveys. We wanted to do this agency-wide for a couple different reasons. One, so we could really have a valuable, get data and really be able to use that data, capitalize on the data agency-wide, and also so we would be aware of what surveys are going out. So we don't want to overburden people with sending out surveys and overburden stakeholders. Next slide. We currently have one ongoing survey, and Nick, I'll let you touch base on the ongoing survey that we have out.
Yeah, so our current ongoing survey is focused on bud tender education. So asking a lot of questions about what they see as their role within a retail store, as well as looking at the training that they currently receive and trainings that they would be interested in having available to them in the future. We've also been collaborating with DOH to include some questions that will help them in developing an optional high THC training for bud tenders. The survey is currently recruiting. It launched around the beginning of February, and we have about 200 responses so far. We've emailed and mailed physical flyers to retail stores and are also just actively looking for new ways to help boost participation before we close out.
Great.
So we're really excited about this. This is the first survey that we have worked with the IRB with. So this was a first step for the research program at LCB. So a nice little win for us.
Yes, it
we'll take
is.
the win. Next slide. Any questions about that ongoing survey? We'll have more information as we start to wrap it up.
Great. No questions.
And then the final agency-wide strategic goal is having a culture of trust, belonging, and valuing people. And really, we just want to take this time to talk about, I think, Tyler, you've been mentioning that this year, this calendar year has been the year of collaboration. And I think you have captured that super well. We have been really working hard. We're a small team, and so we've been working really, really hard on building out our collaborations. And so we'll just take some time to highlight some of those collaborations right now.
Great.
Tyler?
Yeah, so I'll be brief. First one I'll mention on the slide is the UW team submitting an NIH grant proposal for studying cannabis consumption lounges. This is a really good example of something that's emerging. Like, we don't have a lot of research and data yet on sort of the impact of cannabis consumption lounges beyond a policy level. There's been several other states that have implemented them. And so this study is looking to actually start looking at how that influences behaviors. What are motivating people to visit lounges, what kinds of consumption happens in lounges, what happens after they leave the lounges, all these things that to date there hasn't really been any studies on. So we're working with a group in behavioral health at UW on that. WSU NIDA Grant Advisory Committee on Cannabis Misuse Prevention for Young Adults. That also includes our public health education liaison, Kristen Haley, on that advisory committee. The University of California, that's the UC, Cannabis Research Workshop panel is happening a week from today. And Sarah and I have been involved with that. And we will be essentially joining a community of researchers that's wider than just California. California is hosting it, but it's we've got folks from around the country talking about how do we do research on cannabis in an academic setting, and then the panel that we'll be on is in a non-academic setting, so not necessarily grant funded, but we're still making progress on these. And I think I intentionally went forward. So that'll be next week. And then finally, University of Waterloo in Canada, they're the ones that coordinate the International Cannabis Policy Study, or ICPS, which we get their report annually for Washington State, and Nick has created the dashboard to make that data accessible. We also have the actual PDF report on the website.
We've been working to spread that data to other researchers more widely as well. So
That's great. And obviously, this is more formal collaboration, because I also know that you guys are talking to folks at WSU, and you're talking to other folks within ADAI and University of, et cetera, et cetera. So it's just really a great example of what I had envisioned when we started the research team. So great job. Thank you.
Kind of focusing on other agencies with Washington State. Within Washington State, we collaborated with DOH on a cannabis consumer purchasing survey. This was last year in 2024, and that has turned into actually a couple different products. Right, we had a report on it. We created sort of a key takeaways document for retailers who responded to this survey. And then we actually have now submitted a manuscript for publication. And we really feel like this is a good example of a project and products that really help inform industry. Like this is how consumers, as well as retailers, including bud tenders, make decisions about cannabis. So for example, we saw that there was a mismatch in terms of how folks prioritize THC, for example. So we see this as a good way to help inform industry and help them make better decisions as well. Washington State Traffic Safety Summit panel submission with Washington State Patrol. That's something that we've worked on. Nick in particular has worked on pulling together an abstract to submit for that summit that would take place in July. If that gets accepted, and that would be focused on last drink data and kind of the potential to utilize that data, and Healthy Youth Survey, which is an ongoing collaboration with 3 other state agencies, Department of Health, Healthcare Authority, and OSPI, Office of the Superintendent of Public Instruction. I think I said that right. And we're going to give an update on that in just a second.
Great.
And we can actually jump right into that Healthy Youth Survey. This is basically talking about next collaborations. We have a lot of stuff that's going on, and we'll keep you updated as we build out more and more collaborations. So I'll let Kristen and Tyler jump into that Healthy Youth Survey.
All right. Well, good morning, Chair Bollendroff and Member Holmes. Like Sarah said earlier, I'm Kristen Haley, Public Health Education Liaison. And since I'm a program of 1 at LCB, I like to think of myself as an honorary member of many other programs, both internally at LCB and externally with our partner agencies. And there is probably not another program I collaborate with more than the research program. And there's not another project I spend more time on externally than HYS. The Healthy Youth Survey is a statewide survey implemented with select grades every other year. And like Tyler mentioned, the survey is administered in collaboration between 4 agencies. And each of our agencies puts forward staff with expertise in areas like communication, data analysis, survey design, community engagement, and collectively we make this survey happen together. So it's really important to mention everything I'm about to talk about is not just an LCB win, it's a collaborative effort. So as you can see here, the survey is implemented on a 2-year cycle, but that doesn't mean that the work goes dormant in off years. We can look at this cycle on the slide, and I'll start where we currently are here, where the star is. So this is the survey preparation time. This involves IRB approvals, which Department of Health takes the lead on, but we support to some extent. And we also review, we being the royal we of all of our agencies, review a ton of materials, not only the survey itself, which is quite large and takes a lot of time to comb through and make sure all of the edits are correct between survey cycles, but it also involves all of the supplemental materials for parents and schools. And this is our time for like the kicking of the tires, that's what I think of it. So the systems checks, making sure that everything is working right. We're communicating well between agencies, and all of our data sheets and everything are appropriate and ready to go for the survey implementation. We don't do as much from the LCB perspective during recruitment and registration or administration and implementation, but as challenges arise, or as unforeseen events take place, we do have a role as one of the lead agencies in finding solutions. So we're still pretty actively engaged during those stages. And of course, there's always like ongoing minor work that's happening during those months. And then any of the agencies with staff that, as I put it, understand number crunching and survey analysis will pitch in during the huge lift of data processing once the results are in. You can see that says November through February. That's not a typo. It's really just 3 short months to be able to analyze thousands of survey results across thousands of survey responses. And it's a really huge lift that takes a lot of very smart brains to do. And overlapping with this phase is the communication folks from each agency kind of start circling the data people and poking them and asking them to look up from their data analyses and get early estimates for a sense of any themes that might be emerging, or basically anything that we can start writing into a press release and talking points, because the communications people usually are left with the end of February to the middle of March, maybe early April, to be able to get 4 agencies all the way up, all of the chains of all 4 of those agencies, to approve all of the communication materials to disseminate the survey to the public and to all of our partners, which is a really huge lift. The final big lift of the cycle is with survey revisions, and that's what Tyler will talk about again in a few minutes. This process, I think, involves the most collaboration. There's a huge lift of stakeholder engagement. There's many rounds of discussion. There's prioritization that takes place across hundreds of items related to old things that we want to cut, things that we want to revise, or new things that people want us to add. And then we have to agree across all 4 of those agencies. So it takes a lot of diplomacy between our agencies. With that, I'll go to the next slide, Tyler.
Kristen, I'm going to just interrupt for just a second.
Yeah.
So what I'd like to do, I'm aware of the time, and we have a good problem. And that problem is that we had a lot of good discussion earlier, and it cut into the time for this presentation. And actually, given the fact that board member Garrett's not here, and it would also be good for her to hear this information on the Healthy Youth Survey, can we cut this presentation into 2 pieces? We did the earlier on the dashboard and the data briefs. And can we actually reschedule the section on the Healthy Youth Survey so that we can give it the adequate time that it needs? I'm afraid if we continue today, we're going to rush it, and we're not going to give you the time, nor give us the time to ask the questions that would be necessary. So does that work for you guys?
That works, yes.
Yeah.
Okay.
It's fine with me.
All right. I apologize for that. I saw up on the screen 5 minutes left. And so I just trying to keep to the time, but again, want to make sure we honor the time that it takes to have a good, robust conversation about this topic.
Well, and I'd like to make one final comment here, is that one of the reasons why I wanted to combine this is because the Healthy Youth Survey is a regular part of both Kristen's work and the research program's work. And one reason why I like why we don't want to rush this is because, again, it is a regular part of our work. It is not something that goes away. And as Kristen mentioned, it is not on the off cycle or on the off season. It's not something, there are regular meetings, there's regular work, there's regular collaborations and components and throughs.
Yeah.
So we will reschedule so we have time to work through. And Member Holmes, how familiar are you with Healthy Youth Survey? Just so when we come back, we're aware of how much background to give.
I'd say don't limit it. I'm
Okay.
aware it exists, but I would love some more detail.
Okay,
So
great.
even more reason to. So let's consider this part A today, and we'll do part B next time we get together. And let's see if we can get it on the next agenda if that works.
Okay.
I don't have to check with Gretchen, but
Okay.
okay,
sounds
great. All right, thank you very much. I'm really impressed and appreciate the work that all of you are doing, and look forward to having more discussions. Okay, so that takes us to the last item, which is board member and executive assistant reports. So Gretchen, do you have anything?
Nothing, Chair Volendroff. Thank you.
Board member Holmes, do you have anything for today?
Only to say thanks for the great caucus, and thanks to all the presenters.
Great. So I have one quick thing, and that is actually, and the presentation from our research team teed me nicely up for this. And I just want to acknowledge the conversation that we had in last week's caucus and board meeting around board efficiencies. And I want to thank people for your feedback. We've gotten a lot of good feedback, and I take that feedback to heart. And why this ties nicely to our research team is one of the things they were talking about is agency strategic goals. And one of those goals that they ended on was that we have a culture of trust, belonging, and valuing people. And I want to assure everybody that I hold that goal as a high importance. It's very important to me. And I've worked hard to develop a culture of trust and belonging and valuing of people and transparency. And in rolling out the strategic proposed, and I want to emphasize proposed because we've talked about these as proposed changes, I feel like perhaps I didn't communicate it in a way that demonstrated that our ultimate goal was to improve the quality of our meetings. Our meeting quality could stand some improvement, as well as giving us more opportunity as board members to have these types of discussions and conversations. So given that and the fact that board member Garrett's not here, I want to have a conversation, board member Holmes, I'm teeing this up for us to have a conversation at our next caucus about the status of the proposed changes that we've discussed. I've heard enough to know for sure that I want to hold off on changes related to the executive management team until we have some more board member discussion. And then regarding the other changes, I want to have a conversation in our next caucus with board member Garrett present to talk about the strategy for implementation for those proposed changes. So I just wanted to put that out there for you today, board member Holmes. Any comments or thoughts related to what I just said?
I think it's a great idea. Thank you, Mr. Chairman.
Okay, thank you. Thanks, everyone. I appreciate your time. And with that, we'll adjourn. Thank you. I only got 1 minute over.